Hello, good morning. My name is Agustin Alayon, and I think it's my lucky day today because I'm really excited because I'm gonna get my cell therapy today. I learned about this cell therapy from my good friend Michael because I've seen great things happen to him because he has a lot of issues. My body also has a lot of issues, especially my lower back. And at the same time, few years ago, I had my gallbladder operation, and my bilirubin is really high. The reason I really wanted to do this because I don't want to burden my family if ever I will have an issue of my body in the future. But I know that because I've seen a lot of great results and favorable results to my friend, and I believe this is the way to do it. And I'm grateful, and I'm really happy and excited about this one.
Hello everyone, I'm Dr. V. My practice is in Glendale, California. I've been in practice since 1982. I became involved in stem cell therapy probably just a little over a year now, and I've been so excited and amazed on the benefits that cell therapy can offer. I'm going to show you how this procedure is done in a very simple setting. The stem cell comes in a package like this with dry ice, and it's packed in a small vial that can either contain, depending on how many stem cell one is interested in, one can receive from 1 ml, 2 ml, or 4 ml. This thing is frozen, and once we open it, it'll take a few minutes to thaw the frozen stem cell. So I'm now going to open this small package here, and the vial is double bag. This is a completely sterile bag, by the way, and then tear this off here, and there's a ziplock that seals the stem cell, and this is what the vial looks like. This one here, I think, looks like it's a 2 ml stem cell, and it's still frozen, as you can see here. It's solid. But once this vial here is thawed, you will see it's going to form a liquidy form, and there's two ways we can thaw this. Either let it sit by itself, which is going to take several minutes. But a lot of times what I do is, sometimes I roll my hand to make the thawing process a lot more faster. While I'm doing this, I'm going to put this thing down here. I will draw some normal saline to help dissolve that as well, and get the right amount that we will be infusing. So normally we mix this with about a total of 10 ml or 10 cc of total of mixture of the stem cell plus the normal saline. I'm going to draw about 8 cc of normal saline, and I'm going to mix it with that vial of stem cell. And this would also expedite the thawing process. So now one of the important things is to make sure this thing, all of the needle and as well as what's inside here is is sterile so that the chance of introducing infection into the system would be minimal in a sense. So I put in about maybe 2 cc in there to just kind of accelerate the thawing process and tilt this back and forth, and hopefully it will melt the frozen stem cell. So while I'm doing this, once it's melted, I will transfer change my needle to a spinal needle, because this needle that we have here is not enough to really aspirate or transfer the stem cell into the syringe, okay? So I decided to use a longer needle called spinal needle. I'm now gonna transfer the stem cell into the syringe that will be used to infuse into the vein.
Smart.
So one thing that I have to point out is it's important to have a needle that's long enough to reach down to the bottom. That way you don't waste any stem cell. So once we transfer it here, you're able to tilt this back and forth to mix the stem cell, and this is ready for infusion. All right. So when I start the IV line here, it's important that we create a sterile field here by using an alcohol swab and using this angio cap here. Okay, so now we have an IV line here. As you can see, the water is dripping there, and it's important that while that thing is infusing, we need to secure this. Okay, so once we have an IV line open like this, we can now administer the stem cell. And there's a port here where we can insert the needle so that I can slowly push the stem cell into the vein and infuse it slowly. And you can go either 5 minutes, 10 minutes, or in some cases, I can either push it even faster than that. So while that thing is infusing, I'm also pushing the stem cell solution. How are you doing, Gus?
A little bit scared, but excited. So it's a mixed feeling.
Any pain?
No.
Good.
First of all, thank you very much, doctor, for giving me this procedure. And I'm really excited of what I got today. And it's just like a simple flu shot. That's my experience. I didn't feel any pain. And I'm really excited to monitor for the next few days. And at the same time, I would like to update everyone. And thank you very much.